Namaste, I am Dr. Ashutosh Pradhan and I cordially invite you and welcome you to our YouTube channel which is named as Wellbeings. Please check whether you have subscribed our channel. If not, then please click the subscription button and do subscribe our channel, and then click this bell icon, the downward arrow, and from there you can select all so that you will receive all notifications as soon as a video is uploaded on our YouTube channel. Couple of days back we have uploaded one video wherein we have invited comments from audience that what sort of videos they are looking for and they would like us to cover. So we received a request for a topic which says that how to take homeopathic medicine. So today I am presenting, or I am coming to you with this video wherein I will give all the instructions on how do you consume homeopathic medicines. Typically, more or less in all the clinics, the similar way homeopathic medicines are dispensed. Yet there would be some finer differences between the approaches towards the patient and dispensing the homeopathic medicine. So I would request that if at all whatever I am sharing in this video, if it doesn't match to the homeopathic treatment you are taking from somebody else, please do contact that particular doctor. We usually dispense medicines in this kind of envelope where we have the bottles included in this particular envelope. We have printed all the instructions on the back of the envelope also. So instead of blatantly covering the points, what I am going to do in this video is I am going to explain you the front portion of our envelope, what has been printed on the front portion of the envelope, as well as the instructions printed on the back side of our envelope with regards to the images which we have captured on our system, so that we don't miss out on any point. These instructions are more or less uniform but may differ from homeopathic doctor to doctor. So let's begin. This is the front portion of our envelope. So I am going to explain what all is printed on this front side of the envelope, so that if you are taking our treatment, you will understand what things to look for on this side of the envelope. So on this side, on the top, you will find the date written here on which the medicines are dispensed in this particular envelope. Then there is a space for name, wherein we will write the patient's name or the person who is taking the treatment. For the convenience sake, I will write my name, and then you will find that there is one tick here on this box which says that if at all you have to take our appointment for the next follow-up or a new case, you need to send us a message on WhatsApp to take the appointment. If at all we have given you an appointment which is maybe 10 days ahead of whatever follow-up we had today, so the date might have been written as say 26th of April 2024 at 7:30 p.m. and instead of this tick, maybe you will find a tick here. So you need to look for, or we will obviously guide you that whether you need to take an appointment on WhatsApp or already we have allocated an appointment next week or 10 days later on the same day on which you had the first follow-up. After that, you will find our contact numbers. For taking an appointment, you need to contact me on this number, which is 9920070300. So for any appointment, I am the coordinator for our clinic, and if at all you have taken treatment from Dr. Anjali, or if you need to talk to Dr. Anjali, you can WhatsApp her on her number. Her number is also printed on the envelope, and you can take that number and you can contact her as well. Then comes our schedule, weekly schedule, which says that our clinic is closed on Saturday evening, Sunday whole day, and any kind of festive holiday. So what do you mean by festive holiday? Say for example, if at all we are going to celebrate that holiday at home and there will be a lot of guests at our home, then we may not be attending our clinic on that particular day, which is a festive holiday. For example, maybe Diwali or Ganesh Chaturthi, the clinic will remain closed on these days. But some other days like Ram Navami, where we don't have any celebration as such going on at our home per se, that day our clinic might be open. So you need to WhatsApp me on this number and check whether the clinic is open or not, and whether you can schedule an appointment on that particular day or it's not available. What comes next is our websites are listed here. We have two websites which are fully functional. We have articles written by us on those websites. The first one is www.wellbeers.com, which is our clinic website, as well as a lot of lifestyle modification as well as other instructional articles you will find on wellbeers.com. Second website is www.drpradhan.com, which is live since I think 2000-2001, and there is a lot of homeopathic material, homeopathic articles available on drpradhan.com. So I would request you to visit both our website, wellbeers.com and drpradhan.com, for more details and more articles written and compiled by us. Now, there is an address written on our envelope, which you will find those who have already visited our clinic or those who know us prior to seeing this video, they already know the clinic address, but you will find that there is a clinic address on the envelope as well. Now you will find the below space is kept blank. Now this space we utilize for special instructions to be given to our patients. Say for example, if we have given some medicines, so let's see what is been packed in this particular envelope. So this is an envelope. I'll just open this envelope in front of you so we know. So these are two bottles which are packed in the envelope, and we dispense homeopathic medicines in this kind of two bottles. We are going to see how to consume medicines from these bottles maybe in a couple of minutes from now. But suppose, say for example, these are blue bottles, these are blue cap or blue colored cap bottles. But say for example, we give you another bottle which is red colored bottle. So we'll write a special instruction here saying where red is OSAA. So this kind of an instruction may be written on the blank portion of our envelope, which says that you have this envelope includes one more red colored bottle which is SOSAA, that needs to be consumed only when we are going to tell you on WhatsApp message and ask you to take 3 or 2 doses or 1 dose from this particular bottle. Till then, you just have to retain this bottle as it is in the envelope. Don't discard this envelope, because this envelope has date mentioned on this, and our records, our case paper has a date mentioned on the case paper, so that we can connect and correlate what type of medicine we have dispensed on this particular date. Or I have told you about a red bottle. Maybe there are a couple of more bottles like 2, 3 and so on. So you need to check this instruction on this side and below at the bottom to know what type of bottles are included in this particular envelope. And obviously, if there are any other special instructions which we need to give you, those instructions will be written on this particular blank space at the bottom of the front side of our envelope. I hope whatever I have explained about the front side of the envelope is very clear to you, and if at all stage you have any questions, do comment below on the comment box and do ask us questions. We will cover your queries and we will resolve your queries in the next upcoming video. So let's move on to the next side of the envelope. So this is the back side of the envelope. I will just show you, this is a back side of the envelope which I have taken a clip, I have taken a photograph, and we have this particular back side of the envelope here. Now you will find that there are instructions printed on the back side of the envelope. So let's move on to each and every instruction and we will discuss each and every instruction in detail. First instruction is with regards to the 2 bottles. So let's move on to the 2 bottles. It says that there are 2 bottles, smaller bottle and bigger bottle. So this is the smaller bottle. Let's consider the instructions with regards to the smaller bottle. It says that the smaller bottle includes 6 pills. That means 2 pills each time comprises of 1 dose. So you have to open this cap and directly take 2 pills in this cap and directly pour it below your tongue and chew them. You don't have to swallow the pills along with water. You need to chew them thoroughly, keeping them below your tongue, because there is a lot of nerve supply below your tongue and the medicine starts acting stimulation of that nerve supply. So you'll find the link of the video below in the description box. Please, I would request you to visit that particular link and do watch the complete video to know how homeopathic medicines acts when you chew them below your tongue. The smaller bottle has 3 doses. If at all you have visited us in the evening, so you need to take 1 dose at night time, half an hour before going to bed and half an hour after having dinner. That is the first dose which you will be consuming. The second dose you have to take it next day early in the morning, completely on empty stomach. Don't brush your teeth with toothpaste or tooth powder. Please rinse your mouth with plain simple water. Let 5 minutes go, and then after that you can take 2 pills, chew them below your tongue. Then after half an hour of consuming that second dose, you can brush your teeth and then you can follow your routine where you have your tea or anything else which is followed after brushing. Now only 1 dose is left in the smaller bottle that needs to be consumed next day at night time, before half an hour before going to the bed, same way as what you consumed the first dose in the first day itself. Suppose by chance you have 2 or 3 pills left over in the smaller bottle next day at the time of taking the third dose, you can consume all 3 pills at the time of consuming the third dose. So no need to consume only 2 pills. You can consume all 3 pills and then there will be no pill left in the smaller bottle. So from the next day you can start with the bigger bottle. Bigger bottle, here we have already mentioned 707 is the dose. 7 pills in the morning and 7 pills in the evening, 0 pills in the afternoon. That means no pills has to be taken in the afternoon. That is why we have written here or printed here is 707 is the dose. Now this bottle is specifically of 2 weeks size, so I mentioned 2 weeks here. Maybe you will find 5 days or 3 doses or 6 doses mentioned, and the other options which are not applicable are cancelled from here. So you need to open the cap, take 7 pills in the cap, directly pour them in the mouth, keep them below your tongue, chew them and finish off the dose. This is all about the 2 bottles, smaller bottle as well as the bigger bottle. Now let's move on to the next point, which says that when to take the medicine. As I told you earlier that the 3 doses needs to be taken, 1 at bedtime, 2nd early morning and 3rd next day at the bedtime. How will you take the rest of the doses? You can have the medicines on empty stomach as well as on full stomach, but half an hour gap has to be maintained. Few years back, or rather few decades back, people used to say that you should not eat onion, garlic and you should not drink coffee. But nowadays we advise that you can have onion, you can eat garlic, you can drink coffee, but you need to follow a half an hour gap. Don't eat or drink anything half an hour before taking the medicine as well as half an hour after taking the medicine. But plain simple water is allowed. That is the only exception which you can have, either 5 minutes before taking the medicine or 5 minutes after taking the medicine. But there should not be anything which is put in the water. There should not be any item which has been soaked in the water, and you should not drink that kind of water. Only plain simple drinking water is permitted 5 minutes before and 5 minutes after taking the medicine. Now let's move on to the next point, which says, or which I have already covered, that do not touch the medicine. So you need to take it, you need to pour those pills on the cap or directly pour it in the mouth. The next point is hold the pills below your tongue and allow them to dissolve below your tongue so that it works in the optimum way. Don't swallow with the water. The next point is about coffee. That's quite a lot of debatable kind of a topic where people say that you should not drink coffee if you are taking homeopathic medicine. But that's not the case. Coffee antidotes effect of homeopathic medicine, but it does not antidote effect of all homeopathic medicine. It plays a role in certain or specific homeopathic medicines. So if at all, whatever medicines we have dispensed to you are going to be antidoted with consumption of coffee, we will personally guide you and we will personally tell you that don't consume coffee even if you are a regular coffee drinker. So what we say here is, if you are a regular coffee drinker, means that if you are taking coffee every day, once or twice in a day, then you can take coffee or you can continue taking coffee along with the homeopathic medicine. But you should stick to the half an hour rule. No coffee or nothing half an hour before and half an hour after taking the medicine. The next point says about the appointment system. Partially I have already explained you that you need to send a WhatsApp message on my mobile, that's 9920070300, to take a prior appointment. So which is printed here, and it also says appointments are of two types. One is that you see us personally across the table at our clinic, and second, you need to just call us and inquire or call us and discuss about your health issues. For both, you need to take a prior appointment with a WhatsApp message, and then you need to call us on the specified time. You may have a question that why is it so? Why cannot we call anytime randomly whenever we wish to call? This is for the purpose that whenever we are seeing a patient, or if suppose we are taking a new case and the patient is disclosing very important facts about his or her life, and if we receive your call, then the patient will get disturbed and her chain or his chain of thought gets broken, and then we will lose important portion of the patient's information with whom we are engaged in taking a new case. That is why we sincerely request you to take a prior WhatsApp message appointment and then call on the specified time. Don't call randomly as and when you can give us a call. The next point is we do have other options, like apart from homeopathic treatment, our clinic do offer yoga therapy, then wellness coaching, game counseling and nutrition consultation. So what we recommend here is that if at all you need to have a yoga therapy session, or if at all you need to have wellness coaching session or any other session, we request you to take another appointment for these sessions. Don't club homeopathic treatment along with those sessions, because our appointment schedule will go haywire and we don't permit these two combination together. So we recommend you to take a separate appointment for yoga therapy, wellness coaching, game counseling and nutritional consultation. So Dr. Anjali offers yoga therapy, and you can contact her about yoga therapy and you can schedule a session with regards to yoga therapy and your whatever ailment you are suffering from. Also, few people make a mistake that while taking an appointment, they say that I want to take an appointment for myself. And when they come down in person across the table, then they tell us that I want medicine for my spouse, I want medicine for my children, I want medicine for my parents, and so on. He or she might have taken only a single appointment and ends up collecting medicine for 4 or 5 other family members. We sincerely request you not to take an appointment only for one individual. While taking such a family appointment, you should tell us that you need to take appointment for your spouse, your kids, your parents, and tell us exactly you are going to collect medicines for how many people, so that we can have a proper schedule and we don't ditch somebody else who is coming in after you, and we don't skip the next appointment's time and our schedule doesn't get haywire. The next point is about people say that, doctor, we are not able to personally come to your clinic. Then what? We also take online appointments and we also see patients online. All of us have already experienced the pandemic. Let's divide the period pre-pandemic as well as post-pandemic. During pre-pandemic era, we used to have online appointments only for patients who were staying outside Vilepalli. But during the pandemic, even the Vilepalli citizens experienced that it's very convenient to have online appointment with us, and then they can just simply collect the medicines from either from the security desk, or they can visit our clinic and during the working hours they can collect the medicine. But even during that time, we request that if you are collecting just the medicine dispensed in the envelope, we will just simply hand over the envelope to you when you visit us during our working hours, because at the same time we might be seeing another patient across the table. You can take an appointment for a new case as well as you can take a follow-up appointment online. At the moment, we use Microsoft Teams as our app or software to receive new cases online or follow-ups online. So that's about online patients. The next point what we say here is for homeopathic treatment, you need to be very regular for optimum result and complete cure. It's commonly said that whenever you want to be fit, you enroll yourself for a gym. But whenever you enroll yourself for a gym, unless and until you regularly visit a gym and do the exercises, you will not be fit. The same rule applies here to the homeopathic treatment, or rather any other treatment. If at all you don't consume the medicines regularly and meticulously, you will not be completely cured of whatever ailment you are suffering from. Before starting the treatment, you can discuss with us that how much time you need to continue your treatment, and whatever time frame we have advised you, we recommend that you follow that time frame regularly for optimum result and get cured of whatever ailment you are suffering from. Comes next is the common question when you have taken an online appointment and we have treated you distantly, how will you make the payment? The preferred mode of payment for us is a transfer through BHIM, BHIM UPI app. So that is why we have mentioned our UPI IDs here, and you can make payments on these UPI IDs, health at SBI or dr.anjali at SBI or wellbeings at SBI. If at all you want to make payment via Google Pay, we have already mentioned our Google Pay numbers on the envelope. My Google Pay number is also mentioned, Dr. Anjali's Google Pay number is also mentioned, and Wellbeings Clinic Google Pay number has also been mentioned on our envelope. Now whenever you search for my number, you may find my name truncated by Google as Dr. Ashutosh Chandra. But you can click on that particular name, Dr. Ashutosh Chandra, and on the second screen you can verify it belongs to the same number 9920070300 and continue with the payment. We also have a QR code printed here on the back side of our envelope. You can see this particular QR code on the back side of the envelope. So you can just simply scan this QR code and make the payment. So this is all about the instructions printed on our envelope on how to take homeopathic medicines. I hope this video will help you consuming homeopathic medicine in the proper way, and if at all still if you have any questions, please feel free to ask us any questions below in the comment box, and we will try and resolve those queries in our next video. Thank you very much for visiting our channel and viewing this video to the end. Thanks a lot.